back to the Wellness Effect, starting our series of discussions on substance abuse and the process of recovery involved for those who suffer from it. We'll be finding out what exactly substance abuse is. Please remember to hit the subscribe button so you don't miss out on any of our future episodes. Psychiatrist Dr. Tsepiso Mhlane joins me for today's discussion. Welcome, Doctor.
Morning, Seth. I'm happy to be here.
Excellent. So maybe let's demystify what is substance abuse?
Right. So, substance abuse is a process where people use substances. It's any kind of substance, any mind altering substance. They can be illicit substances or they can be prescription substances. And they use it to an effect where it causes dysfunction
Hmm.
in their lives. And it also causes a lot of distraction, and they're not able to kind of fulfill their ordinary duties at work or parenting or at school, etc.
Hmm. So you mentioned substances that stimulate. Could you maybe break down what those might be? Is it alcohol? Is it drugs?
Okay, so there's different kind of
Sure.
substances. So obviously some of that. So you get things like alcohol, you get things like cannabis,
Yes.
and then I think if you discuss with a lot of substance abusers, they use a lot of terms kind of loosely,
Hmm.
where they'll say things like these are uppers and these are
Yeah.
downers. So I think stimulants are what people will refer to as uppers,
Sure.
and kind of colloquially, this is what I would term like your party drugs.
Okay.
The things that keep you awake, keep you up, sort of give you that fake energy to dance
Okay.
all night.
Yeah.
Things like your ecstasies, your cocaine,
Yes.
your crystal meth
Yes.
would be examples of what stimulants are.
Okay.
But I also think on the other side, we do have prescription medications that are also stimulants.
Correct.
So medications that are usually used to treat conditions like ADHD,
Hmm.
so your methylphenidates, or what people usually term your Ritalins,
Hmm.
are also stimulants.
So, Dr. Mhlane, why do people utilize substances recreationally?
That's a tricky question.
Sure.
I'll attempt to answer it. Um, I'm not sure why we need mind altering substances in
Mm.
order to have fun. But a lot of the times, people feel like they cannot enjoy themselves or have fun without being altered in some sense. There's this perception that in order for things to be enjoyable, you cannot be clear headed, rational,
Mm.
etc. I'm not sure really why. I suppose it's just a societal thing, that people feel like that is the definition of
Mm.
fun, and maybe something that we need to change. Yeah.
Absolutely. And who is at most risk at abusing substances?
I suppose the easy answer is everyone, right? But I think if we kind of looking at more vulnerable
Yes.
populations, I would say people who have a family history
Mm.
of substance abuse, like kind of within their family, will be at higher risk of utilizing
Sure.
substances or going kind of down the same path. And then I think as well, people who are vulnerable kind of psychologically, who struggle to
Mm.
cope, etc., because people tend to use substances a lot
Mm.
when they're going through stresses.
Mm.
I've heard a lot of people saying, I had a bad day at work, so I'm going to drink.
Mm.
I'm struggling with this, so I'm going to drink. So people tend to don't really have good coping skills, will
Sure.
usually kind of default into substances. And then I suppose people who have mental illnesses,
Mm.
because I think substances is one of the conditions that occurs quite comorbidly with mental illnesses.
Mm.
So once you have a mental illness, your chances of also developing another mental illness increases, and substance abuse is a mental illness,
Mm.
and so people with mental illnesses will also be at high risk.
But what can we do when we start noticing maybe a colleague, family member having issues with substance abuse?
Yeah, I think the difficult part about assisting someone who is struggling with abuse is that part of the treatment or the crux of helping them very much depends on their participation.
Mm,
People need to comprehend that I do have a problem. And I think that's where the difficulty comes,
mm,
because we tend to want to say, I've got it under control, it's not that bad,
mm,
and our insight is very, very poor. So I think the first line is basically trying to talk to them, encouraging them, and basically being able to motivate them to
mm.
get the help that they need.
Sure.
Um, Showing them in a way that they will understand or take it in that, look, something is wrong. And
Mm,
that sometimes requires like more than one person, or maybe if they have a very supportive kind of employer, getting the employers on board. So many different people within that person's circle to kind of say something is wrong. And hopefully they'll get to a point where they say, okay, let me get the help.
mm,
I mean, some people will then say, look, we've had it with this person. They're really struggling. They don't want any help, and we want to help them regardless. So there are ways of kind of forcing people into rehab. You can section them from a legal point of view. Sometimes we know that using substances, we've already said that it can be destructive in life.
yes.
So let's say they use the substances and land up maybe being arrested for stealing or something.
Mm,
And so through the legal system, they can be forced into a diversion program
sure.
where there's kind of an order put through where they're forced to go into rehab. I
Mm,
think all of those things are in place, but the bottom line is that when we force them, sometimes it works and sometimes it doesn't work.
yes.
And I would basically say that the best way is to try very hard to get that person's participation so that the prognosis can be a lot better.
So, what are you noticing in terms of trends of individuals who are using substances in South Africa?
What we kind of seeing at the moment is that there's pretty much an upward trend of substance abuse. I mean, a lot of people will tell you that during COVID
Yes.
there was quite a spike, and I mean, we all tell the jokes of how people just basically sat in their homes and drank, or
Mm,
people going into dodgy places to buy that bottle of alcohol. But I also think for me, the biggest concern is how social media kind of portrays substances and kind of makes it a little bit. Uh, can you still use the word cool?
yeah.
Um, very cool. And so what starts to happen is a lot more young people think it's not that bad,
Mm,
and I can use it,
yes.
etc. So I think some of those things are pretty much concerning,
Okay.
because we do want a different message to come through. We do want people to see substances. We'd rather want people to want to be themselves, want
Yes.
to be clear headed all the time, and learn more healthy ways of enjoying life
Mm,
than the destructive kind of pathway of substance abuse.
mm. So, does the environment that you live in, let's say you live in a poverty-stricken community, and drugs is almost everyone in the community um, is facing that issue of substance abuse. Does your environment have a role to play?
The quick answer to that is yes. I think your environment will influence you in a particular way.
Mm,
Obviously, if you are around a place where everyone is using, the chances of you kind of going down that same path will be
mm,
higher. And I'm guessing that the wanting to go a different way might also elicit very negative
yes.
views from your environment or the people around you, which would make it a bit more difficult for you to be well.
Mm,
So I think yes, environments definitely do influence
hmm.
your use.
Amazing. So, Doc, we've kind of mentioned that substance abuse does affect poverty-stricken areas, but what about high stress environments?
That goes back to what we had discussed about kind of vulnerable people,
Mm.
people with poor coping, because sometimes when people are struggling to cope with day-to-day stresses, then they'll turn to substances. I think the other part around that is, you also need to think about different occupations
Mm.
that increase your risk of using substances, like, for instance, things like the entertainment industry,
Mm.
where it's kind of seen as it's okay, and the chances of people using become quite high. In those
Mm.
instances, your things like cocaine,
Yes.
etc. I think we've already kind of discussed things like the party drugs,
Yes.
where people would kind of use it to stay awake all night and dance all night, etc. So I
Mm.
think even uh, uh, occupations can put you at risk
Mm.
of using substances.
Sure. And now we've had this move of the legalization of, marijuana. What's your opinion on that?
Yeah, I think psychiatrists became very unpopular with
Mm.
this. We were seen as very anal. We're not moving with the times
Yes.
because it's just a herb and it's okay. But I think the data is there to show that marijuana, I'll say mostly from a psychiatric perspective, is very problematic.
Mm.
And part of the big things that we're concerned about is the fact is its ability to induce psychiatric disorders.
Mm.
So that means that, for some people who use marijuana, they can have psychotic symptoms. Some of them get mood symptoms. It can cause anxiety symptoms. And I think probably the one that people don't pay attention to the most, because I think the rest are major things. If someone is psychotic, it's big. And so people will see it and you'll get the help. But I think the most problematic of them is the cognition.
Mm.
Cognition is what we use on a day to day. If I'm at school, I'm using my cognition, my memory, my focus, my decision making, calculations, etc., impulsivity. I'm using that on a day to day to learn, right? Even if I'm working, I'm using my cognition on a day to day to function.
Mm.
Now, marijuana has been shown to come in and mess with that.
Mm.
And so what you find is that people who used to be sharp, function, do well, are suddenly a bit slower. They can't do complex tasks anymore. And it takes a while for people to kind of realize that, maybe it is the marijuana. And I think the other thing that the data has shown is a lot of that is also directly proportional to how much you're
I
smoking.
see.
So from, a psychiatric perspective, cannabis is not the one.
Mm.
It's not the one to use. It causes a lot more problems than what people think.
That's fascinating. And how about medical use for marijuana? Is that still potential risk?
I think people tend to focus on that.
Mm.
And I think at the moment, a lot of its medical uses are still being
Mm.
investigated. There have been kind of anecdotal cases where it's been seen that maybe it's helped shrink a tumor here or there. But none of that has really been proven.
Mm.
And I know one of the other reasons that a lot of people use it is because it's been shown in some cases that it decreases pain. But
Yes.
I think all of that is still under investigation. So no one can
Mm.
tell you that it is this amount of dacha that
Mm.
will cause your pain to be less, or this is how you use it in order to decrease pain,
Mm.
right? So I think people are kind of prematurely
Okay.
jumping at utilizing the marijuana.
Mm.
But the fact is that its ability to cause psychosis, its ability
Mm.
to cause cognitive dysfunction, its ability to cause mood disorders is there. So there we have the data we can show
Mm.
that it does cause that.
Join us in the next episode of The Wellness Effect as we take a closer look at recovery from substance abuse. Thank you so much, Dr. Mhlane, for such an engaging and insightful conversation.
Thank you for having me, Seth.
Remember to subscribe, and we'll see you next time. BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.